Hey, I'm Julianne. I'm a nurse practitioner, functional medicine provider, and gut health expert. And today we're going to be talking and taking a deep dive into H. pylori. Now, H. pylori has been termed the most successful pathogen in human history. It's been around for at least 200,000 years. H. pylori is a spiral-shaped gram-negative bacteria. Now, why is that important? Well, gram-negative bacteria means that it has two cell walls. Gram-positive bacteria, on the other hand, only have one cell wall. Now, this double outer layer of the gram-negative bacteria makes that bacteria harder for antimicrobial drugs and herbs to affect and kill the organism. That's why it's important. It's actually one of the hardest things to get rid of that I see on functional testing. It's estimated that 2/3 of the world's population is infected with H. pylori. So how does that actually happen? Let's talk about how you can contract H. pylori. There's a higher prevalence of the infection in developing countries, and it's usually due to contaminated drinking water, people of low socioeconomic status, and other just poor living conditions. Now, for most of us in developed countries, it is as simple as just sharing drinks or utensils with someone who is already infected with H. pylori. So it's spread primarily through saliva and feces. Those are the two most common ways to contract H. pylori. And it actually often occurs in childhood. We're actually often contaminated or infected in childhood, even if we don't have symptoms right away or ever. H. pylori is found in the stomach. That's kind of where it lives, in the upper gastrointestinal tract. And it's one of the few bacteria that are able to colonize in this really acidic environment. You should also know that H. pylori may be able to colonize in the acidic environment of the vaginal cavity. And so the vagina can act as a reservoir, allowing sexual transmission of the bacteria. Very important when you're discussing with patients, talking about transmission and talking to their partners about potentially having this bacteria as well. So for these reasons, when I'm working with a patient who has H. pylori, it's really important to share this and how it's transmitted and have a conversation with their partner. If they have a partner, it's recommended that their family members, especially their partner, either get tested themselves or take the treatment because there's such a high rate of transmission. Now, if we treat a patient but the partner isn't treated, they will likely just get the infection back again and not completely rid it from the body. So this is just an extremely important conversation to have and concept to understand. H. pylori produces an enzyme called urease. Now, this enzyme makes your stomach acid less acidic. It basically neutralizes your stomach acid. The normal pH of the stomach is around 1.5 to 3.5. And if your stomach pH is less than 3, you have normal acid levels. If the pH is 3 to 5, you have something called hypochlorhydria or low stomach acid. Why is this important? Stomach acid is crucial to digestion. Low stomach acid causes a host of issues. If you don't have enough stomach acid, you cannot break down and digest your food properly, especially protein. You also won't be able to absorb nutrients from the food. Many people with H. pylori will develop nutrient deficiencies, things like vitamin C, vitamin A, vitamin B12, and folic acid deficiencies. Also, if you have a B12 deficiency, that can lead to something called pernicious anemia. So you can see there can be some significant issues with H. pylori, low stomach acid, and nutrient deficiencies. Now, just a few symptoms of nutrient deficiencies: brittle fingernails, hair loss, pale skin or mucous membranes, fatigue, weakness, numbness or tingling in the hands, memory loss, headaches. So keep these things in mind if you think or suspect you have H. pylori or you're working with a patient who has H. pylori. You may start to see some of these signs and symptoms of nutrient deficiencies. Other issues or symptoms that are associated with low stomach acid are just feeling like food is sitting on the stomach and not going anywhere, not digesting. It can also cause either constipation or diarrhea, indigestion, undigested food seen in the stool, malnutrition, and also bacterial overgrowth. Because remember, every day on a daily basis, we are constantly coming in contact with bad pathogens, whether it's a virus, bacteria, parasite, or some type of yeast. We're coming in contact with these things. And if we ingest these type of pathogens, often the stomach acid will destroy these pathogens before they can start to grow and multiply in our body. That's what we want. But again, if we have low stomach acid or hypochlorhydria, we have lost that first line of defense. So that is why stomach acid is extremely important. If you suspect that there is hypochlorhydria and it's coming from an H. pylori infection, there are a few other labs that you might want to consider getting. A CBC or complete blood count, a comprehensive metabolic profile or CMP, an iron panel, a thyroid panel, a B12 level, and an intrinsic factor. Those are some other labs that you may want to consider getting. But first, let's talk about how do you even know if you have H. pylori? What might be some of the symptoms? It is estimated that up to 90% of patients with H. pylori actually will not experience any specific symptoms that they can identify. But when patients do have symptoms, we're looking at things like bloating, gas, constipation or diarrhea, indigestion, maldigestion, dysbiosis, which is an imbalance in good and bad bacteria in the microbiome, low stomach acid, nutrient deficiencies. We can also see things like mood swings, anxiety, depression, because H. pylori causes inflammation of the nervous system. So we can see these neurological issues. Also, about 10% of patients with this bacteria develop ulcers. Now, it's estimated that more than 90% of duodenal ulcers, which occur in the upper small intestine, and 80% of gastric or stomach ulcers are caused by H. pylori. So if you suspect that you have H. pylori, or if you're working with a patient who you suspect may have H. pylori, how are you going to know? What testing is available? The first one is a blood test. This tests for the antibodies to H. pylori. Now, antibodies are protective proteins that are produced by your immune system. They attack antigens. Now, an antigen is really any foreign substance or object, things like bacteria, viruses, parasites, really any foreign invader. The blood test will not tell you if the infection is active. It will just tell you that you have antibodies, meaning it could be an active or present infection, or it could be a past infection. Therefore, the blood test is probably not the best test for you or your patient. Next up is the breath test. Now, the breath test measures the amount of carbon dioxide that you exhale. This indicates the presence of H. pylori in your stomach. So again, H. pylori produces an enzyme called urease, which breaks urea down into ammonia and carbon dioxide. So the way this test works is, first, you would exhale into a bag to measure the level of carbon dioxide. Then you'll be asked to drink a small amount of a solution that contains urea. 15 minutes later, after drinking the solution, you would exhale into a second bag. The amount of carbon dioxide that you exhale into the second bag is also measured. It is based on the ability of the H. pylori to convert urea to ammonia and carbon dioxide. If H. pylori is present, it breaks down the urea solution that you drink. It's releasing carbon dioxide in the breath that you exhale. So if the amount of carbon dioxide in your second sample is higher than the amount in your first sample, then you have a positive test for the presence of H. pylori. Test number 3 is an endoscopy. Now, an endoscopy is an invasive procedure. When we do an endoscopy, it's often for other reasons, to see if there are any structural issues and just to get a good look at the anatomy and what's going on inside the esophagus and stomach. The endoscopy is used to culture and biopsy the stomach mucosa for a rapid urease test or histologic staining. So given that this procedure, it can be costly, it is invasive, it's typically reserved when, again, there are images needed for other reasons. And lastly, my personal preference and most comprehensive test is called the GI map test. This is an at-home stool test that looks for the antigens to H. pylori in your stool. So it relies on something called qualitative polymerase chain reaction technology, or qPCR technology, to detect the bacteria by targeting the specific DNA of the organisms that are tested. Now, this stool test also includes other markers for digestion, absorption, inflammation, immune function, and all of this helps to evaluate overall digestive health and function very comprehensively. Another thing that we get to look at on this GI map stool test are the detection of virulence factors. Now, the GI map looks at 8 different genes, and these positive virulence genes represent the potential for an H. pylori strain to create pathology such as duodenal ulcers or gastric cancer. It should also be noted that of those that harbor H. pylori, only about 2% develop gastric cancer. But this will give us insight into genetic characteristics. For example, some of the genes, such as the duodenal promoting gene A and the outer inflammatory protein A, are known to promote lots of inflammation. Another example is cytotoxin-associated gene A and vacuolating toxin A. These can disrupt the tight junctions in the gut lining, leading to leaky gut. Now, why is all of that important? Having this type of data can help to guide therapy, and as a practitioner, you will want to be sure that you treat these patients with positive virulence factors very aggressively and be sure that we fully eradicate the H. pylori. So retesting in this population with positive virulence factors is extremely important. All of these tests can be ordered through Rupa Health. Now that we've discussed what this very common pathogen is, what the symptoms are, and how to test for it, let's talk about how to get rid of it. First, I'm going to talk about conventional treatment modalities. H. pylori infections are often conventionally treated with at least 2 antibiotics at once. This helps to prevent the bacteria from developing a resistance to one particular antibiotic. You should also know that with a GI map, you will actually get results for H. pylori antibiotic-resistant genes. Now, what does that mean? The antibiotics tested for are amoxicillin, clarithromycin, tetracycline, and the class of fluoroquinolones. So if on the GI map we see an antibiotic resistance gene is present, then we know that that class of antibiotics is designated positive for antibiotic resistance. A positive result for the presence of these resistant genes for a given antibiotic indicates that that antibiotic is not an ideal choice for that particular patient's protocol. So antibiotic resistance genes apply to all of the microorganisms found in the sample. And very cool fact, microbes can rapidly share DNA under stress. So the presence of antibiotic resistance to any organism is reason enough not to use that antibiotic or antibiotic class. In addition to antibiotics, conventional treatment will also likely include medications like proton pump inhibitors. A proton pump inhibitor is a drug that stops acid from being produced in the stomach. Now, some examples of these would be things like omeprazole, esomeprazole, lansoprazole, pantoprazole. The problem is that we already know H. pylori typically causes low stomach acid, and this is just lending to the problem. Now, these proton pump inhibitors were originally meant to be utilized short-term for patients with active ulcers and really were only meant to be used for around 6 weeks in length. Now what we're seeing is they're used very frequently and chronically, which can actually lead to a host of other issues like absorbing calcium and magnesium, gastric polyps, vitamin B12 deficiencies, the development of an infection called Clostridium difficile, community-acquired pneumonia, osteoporosis, and kidney disease, just to name a few. Bismuth is also a medication that is often utilized, and it works by coating the stomach and protecting any potential ulcerations from stomach acid. One last medication that you may see used conventionally are called H2 blockers or histamine blockers. Now, these medications block histamine, which triggers acid production. An example of this would be cimetidine. And these H2 blockers are typically prescribed for H. pylori infections if a proton pump inhibitor cannot be utilized for some reason. So that is an overview of the conventional approach. Now let's talk about the functional medicine approach, which is not only very effective, but doesn't come with a lot of the negative side effects that we see with conventional therapy. So in my opinion, as a practitioner, the functional medicine approach is the best approach. First up, and this will also be beneficial with conventional therapies, are probiotics. These are beneficial for repopulating the microbiome with friendly, beneficial bacteria, again, whether we're talking about a conventional or a functional approach. Now, there are a few specific strains that have been highlighted in research for their ability to fight the H. pylori bacterial infection. These are Lactobacillus fermentum, Lactobacillus casei, and Lactobacillus brevis. Now, there's also another type of probiotic that is a yeast-based probiotic called Saccharomyces boulardii that also has some data showing that it is beneficial with H. pylori infections. Mastic gum. Mastic gum comes from the stem and the leaves of the mastica tree. And clinical studies have supported and confirmed that it has bactericidal action against H. pylori. Black cumin seed has antibacterial properties against H. pylori as well, and it also has gastroprotective properties. Berberine is a botanical extract found in various plants, things like Oregon grapefruit, barberry, and golden seal. And it has potential antimicrobial and anti-inflammatory properties. Now, research has actually compared the use of berberine to conventional quadruple H. pylori therapy, which typically includes a proton pump inhibitor, 2 antibiotics, and bismuth. And they found that berberine, in comparison to quadruple therapy, is comparable, safe, and effective. Olive leaf not only has antibacterial activity against H. pylori, it also has anti-inflammatory properties. Licorice. Research has shown licorice's effectiveness against eradicating H. pylori and also confirms that licorice is great for healing ulcers in patients with H. pylori-induced ulcerations. Bismuth, again, is a naturally occurring mineral that is commonly used in functional medicine treatment protocols because it exerts direct bactericidal effects on H. pylori and helps to heal ulcers. H. pylori resistance against bismuth has also not been reported. Zinc carnosine has been used as an anti-ulcer supplement for decades. It's also very supportive to the immune system and to healing the gut lining. Research also shows that polyphenols in curcumin, cranberry, garlic, licorice, and broccoli are effective at eradicating H. pylori. Now let's talk about digestive support. We already mentioned the fact that it is very common to have a maldigestive pattern because of the low stomach acid that H. pylori typically produces. So we may consider supplementing with something like betaine HCl or hydrochloric acid. This is commonly used as a supplement to aid in replacing stomach acid and really restoring that good acidic environment in the stomach. Now, betaine HCl can be supplemented with meals to support that healthy digestion. Caution should be used in patients who do have an active ulcer or gastritis because that can be aggravating, but otherwise it is safe to use in patients with H. pylori and will help to restore the stomach acid and help with digestion. Other supplements that you might want to consider that will help with digestion are digestive enzymes or digestive bitters. These are going to not only help with the breakdown of food, it will also help with nutrient absorption. What about diet? What do we tell patients with H. pylori to eat? There is no universally suggested diet that is known to really expedite the eradication of H. pylori. Now, preliminary research is suggesting that a low-nickel diet may increase eradication rates in patients receiving antibiotic therapy. But what we really need to focus on is a well-balanced whole foods diet. We want to consider a diet that is rich in probiotics, things like kefir, kombucha, sauerkraut, yogurt, and fermented veggies. A diet high in omega-3 fatty acids like wild-caught fish, flaxseed, chia seeds. Honey, especially Manuka honey, in moderation, can be very supportive to patients with H. pylori. Incorporating things like berries, raspberries, strawberries, blackberries, blueberries. These have lots of polyphenols and antioxidants. Also, cruciferous vegetables, especially broccoli and broccoli sprouts. Things to consider avoiding are caffeine, carbonated beverages, and spicy foods. And finally, just some clinical pearls. We want to make sure that we address dental hygiene in these patients with H. pylori because the mouth can be a reservoir. Mouthwashes with things like clove can be very supportive. Also, consider the source of exposure. Where might this patient have contracted H. pylori? So we want to make sure that we are educating on the fact that H. pylori is highly transmittable, again, through saliva, feces, and also even vaginal secretions. We want to talk about considering testing and or treating other family members. And we want to also address maldigestion and or that hypochlorhydria pattern if we suspect that that is present. Rebuilding the gastric mucosa by addressing stress management is also very important. Stress management techniques that could be incorporated are things like yoga, meditation, deep breathing, prayer. And also we want to support healing of that gut lining with things like glutamine, aloe, licorice, and vitamin A. I hope that this information has been helpful, and you can find me at juliannwellness.com or on Instagram at juliannwellness. But for more educational videos, please like and subscribe to Rupa Health.